Rocky, along with Conemaugh Health System and Somerset Hospital, we've teamed up with the Cambria County Drug Coalition for the fight against addiction here in the Laurel Highlands with our Hearts Against Heroin campaign. And today we are joined by Ronna Yablonski, the Executive Director of Cambria County Drug Coalition. Thank you for your time today. Appreciate it.
Good morning. You're welcome.
The efforts of the Cambria County Drug Coalition are certainly appreciated, what you're doing. Tell me exactly what is the whole mission that you're looking at.
Yeah, so there's a printed mission that the coalition's committed to making positive change in the creation of drug-free communities across the county. What that means is that we understand that there's not one silver bullet, that there's not one answer to the epidemic that our country is facing and that this county is facing. It's a broad crisis. The coalition coordinators, the people who design the coalition, who build the coalition, believe that this broad crisis requires an equally broad response. Mm-hmm. So the coalition is creating the time, the space, and the means for aligned actions by all. It's an integrated approach with lots of solutions, lots of ways in which individuals working together can impact the community. And when one sector of the community is successful, we all succeed. And so long-term, creating an environment in which there's systems of care in place, where there's strong law enforcement presence, and a lot of moving parts that basically will pull the county through.
And you guys are kind of there to bring it all together. And
correct.
And that's what the whole point is.
Exactly.
Who's all involved with the Cambria County Drug
So there are many members. What I'd like to do this morning is identify for you those executive board members.
Okay.
So the chair of the coalition, Kelly Callahan, who is the county's district attorney.
Okay.
Serving in the vice chair position is Commissioner Tom Cherninsky. In the secretary position, president of the 1889 Foundation, Sue Mann. Our fiscal agent and administrator from United Way of the Laurel Highlands is Bill McKinney. Also serving on that executive board is Dr. Jeannie Spencer from Conemaugh Memorial Center. We have acting chief of police from Johnstown Police Department, Jeff Jansiga. We also have retired healthcare executive John Morgan.
Okay, now if people want to actually contact the Cambria County Drug Coalition and how we can get in contact and other groups can reach out to the CCDC to help fight against the drug abuse. How do we do that?
So we absolutely invite others to become part of our system. So the model that we're following is the National Drug-Free Communities model, which represents 12 sectors of the county. So one thing I might say is that if you're aware of if you have any acquaintance or any contact with any of those executive board members, I would say reach out to any of them and share with them what your interests, what your desires are. Another way would be to reach out to me. I would invite that through a phone call, 814-619-4505. Another means of learning a little bit more about the coalition and understanding who we are and what we hope to do would be by visiting our website. Now, because the coalition is new, I do want to lay the disclaimer out there that the website is a work in progress, continues to be built. So if you check it out once, continue to check it as we continue to develop it. It's www.CambriaCountyDrugCoalition.org.
Since the coalition is new, what are you looking at for the first year goals?
So there's a lot of very steep goals that have been put into place. These are not goals that were just randomly selected or that we're not just really shooting from the hip. We spent months analyzing the county and lots of data sorts and sets from the county. Things that we selected or that all of the team members selected were these couple of things. The first is to decrease the supply of illegal drugs, understanding that creating a difficult environment to minimize illegal drug activity and violent crimes associated with drug use and illegal drug use. That's year one, first goal. The second thing would be to improve systems of care for individuals who are suffering from substance use disorders, or creating an environment where families and individuals can get the support and the help that they need. In addition to that, enhancing drug prevention initiatives. So there's a lot of work to be done. I actually had someone who come up to me and say, there's all this talk about opiate addiction and there's all these things that are being said, and I don't even know what an opiate is. Mm-hmm. And so we can't just assume that people understand when we say we're in the midst of a heroin epidemic, understanding the link between prescription opiate medications and heroin. People don't understand these types of things. And so what we want to do is create educational opportunities, working with the county's youngest residents residents. So we have programs for preschools and elementary, middle, high school, all the way up through the school years. But in addition to that, maybe visiting senior centers, working and partnering with the business community and doing lunch to learns in businesses where we can send professionals into these environments who can share information about the disease concept of addiction, what resources are available through the coalition, and not just all of the coalition's partners, what's out there. And so it's a great way to increase education.
Go ahead.
And the last thing I was going to say is just because the coalition is new, we also have a long-term sustainability plan. A lot of people say, well, this coalition, once you finish this year one, is this all,
done?
Right, and that's not the case at all. This is a long-term plan.
Right.
And so long-term sustainability and creating that is part of our year one goals as well.
Now, do you at the coalition have any services or programs going on?
So the coalition itself has many, many partners who provide services of many levels. So if somebody, for example, says, I'm concerned about illegal drug activity in my community, then we might do something like encouraging them to support law enforcement by making phone calls and tips to push out the pusher. If somebody calls and says, I have a family member who needs some level of care, then we would be able to link them or connect them to whatever care they're looking for. So the coalition themselves, it's not like we have a business or an office where somebody could come in and get a service right on site, but instead we're serving as that hub or that link and connecting people to the services that they need.
Well, thank you so much, Ronna, for coming in, and your efforts are greatly appreciated. The Cambria County Drug Coalition. Again, if somebody wants to contact you, give me the number.
814-619-4505.
It's Hearts Against Heroin, presented by Conemaugh Health System and Somerset Hospital, along with Spangler Subaru, Martin Baker America, Yeager's Heating Service, First Summit Bank, and Rocky 99.
Rocky 99. Burger King presents